I am Jessica, and I am from Irving, Texas. I would like to redo some of my veneers. I have 2 permanents and a couple of temporaries, and 2 that are prepped for veneers, and I really want to cover them up and maybe start anew. I am about to start physician assistant school, and before I become a PA, I would like to have a smile that I'm a lot more comfortable with, because as a PA, you obviously see patients all day long, and first impressions are extremely important, and being comfortable with yourself, I think, makes your patient comfortable. And so that having a pretty smile or a nice smile or something I'm comfortable with, I think will help me in the future as a physician assistant.
Dr. Rowe is an absolute perfectionist, which I love, because when you're getting cosmetic dentistry done, you obviously care about the little details, and the little details in your teeth make a huge difference in your smile. The fact that he paid attention to details, and he knew what would look best with my smile, but he also took into consideration the things that I wanted. And so we kind of blended both of those to make the smile that I have now, and it looks fantastic. Very happy. I expected it to be difficult. I mean, I knew that I had to come in for multiple appointments to make sure we got exactly what I wanted and what looked right, but I feel like in the end that every appointment was absolutely worth it, because it came out exactly like I wanted, and I really enjoyed coming to this office just because everyone was very nice, very professional. They made you feel comfortable from the second you walked in, always asking if you needed anything.
Dr. Jason Rowe, a prosthodontist in Dallas, Texas. As a prosthodontist, I specialize in cosmetic and restorative dental needs. Those type of needs can be crowns, bridges, implants, dentures, any type of prosthetic or treatment that requires specialized care. Jessica presented to our office really with the chief complaint that she wasn't happy with her smile. That happens with lots of different patients. They walk in and there's something that they don't like, possibly gaps between the teeth, possibly older dental work that looks different colors. In Jessica's case, she didn't like that her teeth were short, and she didn't like that the past dental work had begun to stain. Once we got her in the temporaries, she healed. We had allowed for our laboratory technician to tackle the final crowns. We allowed Jessica to talk with him. I talked with him. We interacted all together. It's a team approach. If something is not a team approach, you're kind of guessing at where things are going to go. So we take a team approach, and all of us work together to achieve a result that is both functional and aesthetic. And I believe we achieved that with Jessica.
And one of the things is, on this particular case, is veneers. We get a before a cast, and we have the patient and the dentist information. We get as much information as we can: size, shape, the wants and needs of the patient, the needs of the case itself, specific for function. And we start off with a rough model, wax up something like this, and then we will tweak it according to the patient and the dentist and the laboratory's knowledge.
As I understand it, Jessica was going on to school to be a physician assistant, and this is something that she had always dreamed of having, a perfect smile, something that she wouldn't have to shelter or hide. And that's what gives me joy in my life. When I see patients every day, and it's very comforting to take a patient that is hiding their smile, whether it's with their hand or whether it's with just a small grimace, and then tackle that treatment and finish up in such a way that someone can have confidence, and just it brightens their day to be able to smile. I can't imagine going through life without smiling.